Hello guys. Today we are going to discuss about a drug. It's a laboratory test, carbamazepine. Use of the test. To determine the concentration of carbamazepine in the blood to establish an appropriate dose and to maintain a therapeutic level. This is a drug in it is not present in healthy persons. Some patients such as epileptic patients need this drug. However, the medicine should be in a particular range that is called as a therapeutic range. So for that way, this test is being done. This test measures the amount of a carbamazepine in the blood. Carbamazepine is a drug that is primarily used to treat certain seizure disorder called epilepsy, but is also prescribed to stabilize the moods of a patient with bipolar disease and to help alleviate some types of a nerve pain. It may be prescribed by itself or in combination with other anti-epileptic drug. Carbamazepine levels are monitored because the drug must be maintained within a relatively narrow concentration range. If the level is too low, the patient may experience a recurrence of symptoms. And if the level is too high, the patient may experience increased toxic side effects. This balance can be difficult to achieve for several different reasons. Oral doses of a carbamazepine are absorbed in the stomach and intestine at widely variable rates. Since carbamazepine is metabolized by the liver, anything that affects the functions of liver can affect blood level of the drug. Much of the drug is bound to protein in the blood plasma, but it is free portion of the drug that has the therapeutic effect. Conditions that affect the extent of a protein binding of a drug may affect therapeutic effectiveness. The product of a carbamazepine metabolism, carbamazepine 10,11 epoxide, is also an active compound and continued contribute to overall effect of the medication. Several drugs, if taken in conjunction with the carbamazepine, may alter the effect or affect metabolism and blood vessels. The dose of a carbamazepine must be adjusted carefully until a steady concentration in the blood is reached. The actual amount of the drug required to reach this steady state will vary from person to person and may change over time. Carbamazepine is usually monitored long term because it is prescribed for a chronic conditions which require long term treatment. Seizure disorder affect the brain ability to transmit electrical impulses and to regulate nerve activity. During a seizure, a patient may experience changes in consciousness, alteration in sight, smell, taste, and may experience convulsions, fits. Seizures are associated with the acute conditions such as high fever and head trauma, and with chronic conditions such as a metabolic disorder and brain tumor. In many cases, the cause is not known. The frequency of a seizure varies from a single episode to occasional seizure to a recurrent seizure. Seizures are categorized by the parts of the brain and body that are affected. Carbamazepine is prescribed to help prevent specific type of a recurrent seizure. Bipolar disorder is a psychiatric condition that is characterized by cycles of a depression and mania that may last for days, weeks, months, or years. During a depressive episode, those affected may feel sad, hopeless, worthless, and have thought of a suicide. During a manic episode, those affected may be extremely happy and excited, irritable, have poor judgment, and participate in risky behavior. Carbamazepine is prescribed to help even out the mood of the persons with bipolar disorder, particularly those unresponsive to lithium. Tegmental neuralgia, a condition associated with the facial nerve pain and muscle spasm, and paroxysmal choreoathetosis are also sometimes treated with carbamazepine. It is also sometimes used in the treatment of acute alcohol withdrawal. The sample required is blood. Normally, it is not present in a healthy persons, but some patients need this medication. The conventionally accepted therapeutic range of a plasma concentration of a carbamazepine in adult is 4 to 12 microgram per ml. That is about carbamazepine.